My name's Scott Fortnum. I'm the president and CEO of Children's Health Foundation, and I'm very pleased that you were able to join us this morning for the official launch of Children's Hospital's Sleep Lab. Now, this is a much needed resource for our community, and it's going to help ensure that our kids receive prompt sleep studies close to home, which is so critically important. And this has been made possible through our very generous and caring donors that have been integral in bringing this vital service to Western Ontario. Donor dollars, in fact, have helped fund more than $400,000 of sleep lab equipment, including monitoring equipment, wearable sensors, CO2 monitors, and more. And I'd especially like to thank the Air Canada Foundation as the largest single donor to this program, contributing nearly $80,000. So our thanks. The impact that the Sleep Lab will have on the lives of our children is quite profound. And I'm certainly not the best person to talk about that. So I'm pleased to turn the screen as opposed to the podium. Turn the screen over to Lynn-Ann Mason, Director of Pediatric Inpatients and Ambulatory Care for Children's Hospital at London Health Sciences Centre.
Thank you, Scott. Good morning, everyone. Today is an incredible day as we celebrate the official opening of Ontario's third pediatric tertiary care sleep lab. Providing our children prompt access to sleep studies has been a significant challenge. The other two pediatric tertiary care sleep labs in Ontario, located at Sick Kids and the Children's Hospital of Eastern Ontario, have wait lists of at least a year. And as a result of the global pandemic, Toronto has had to stop being able to accept our referrals. For these reasons, it was imperative that Children's Hospital open our own sleep lab. Untreated sleep issues can have a detrimental impact on our children's wellness. Sleep is incredibly important for their emotional, behavioral, and cognitive function. Once our sleep lab is fully established, we anticipate being able to assess more than 350 patients each year, allowing for prompt treatment of concerning issues. Not only will treatment be prompt, but it will be close to home. It can be time-consuming and financially straining for families to have to travel to Toronto or Ottawa for these sleep studies. Having this service in their own backyard, I'm certain, will be a relief for many. It has been a long road to open this sleep lab, and we couldn't have done it without the generosity of Children's Health Foundation donors. On behalf of the leadership, physicians, staff, patients, and their families, thank you for your wonderful philanthropy. It is a proud moment for us here at Children's Hospital today, as we officially mark the opening of our sleep lab. We are glad that you could all be a part of this celebration. And back to you, Scott.
Thank you very much, Lynn-Ann. I'm going to let us obviously we can't take you through the sleep lab under current circumstances, but we do have a brief video that I will share with you now.
Sleep problems are common in childhood and affect an estimated 25 to 50% of children. During the sleep study, the patient will have wires and sensors attached to their head, legs, face, and stomach. We do our best to ensure the sleepover is as comfortable as possible for the patient. Parents also get to sleep alongside the child. All the wires allow us to get a good understanding of the sleep, breathing, and heart issues that a child may have. Technicians monitor the patient during the study in another room, and the pediatric sleep doctor reviews the information and follows up with the patient at a later date. Your donations not only help to raise awareness and support healthy pediatric sleep, but allow the pediatric sleep team to provide timely assessment and care.
So a brief opportunity to look inside. I'm told that when the kids are there at night, it actually is dark. The lights do go out. We were a little surprised at how bright it was when that video first came forward. Sleep, as you know, is incredibly important to healthy living. It's incredibly important to all of us. It's something we need. And when there are challenges or problems with sleep, it can amplify so many other situations. I'd like to now introduce pediatric respirologist Dr. Aaron Saint-Laurent, who's been integral in the creation of Children's Hospital's sleep lab.
Thank you, Scott. Really, I think, thanks needs to go to many people who have come together to support the creation of our new sleep lab at the Children's Hospital. I'm truly grateful for my colleagues in the Division of Pediatric Respirology and the Department of Pediatrics, our hospital leadership, the Irwin family who has been advocating for the sleep lab for some time, and the Children's Health Foundation donors who gave generously to make this important service a reality. Sleep has a significant impact on children and families. We are making a promise today to ensure our patients receive timelier, comprehensive sleep care closer to home. Our sleep lab has a special focus on diagnosing and addressing sleep-disordered breathing, including obstructive sleep apnea, central sleep apnea, and nocturnal hypoventilation. One of the first patients through our sleep lab was a 14-year-old boy with Duchenne's muscular dystrophy. Duchenne's muscular dystrophy is a rare genetic disease that causes muscle weakness and can affect a child's respiratory muscle strength. Between his underlying muscle weakness and a low reading of oxygen saturation, we were concerned that he was at risk for sleep-disordered breathing and nocturnal hypoventilation. It feels wonderful to know that we will be able to run a comprehensive sleep diagnostic promptly for this patient and to do it close to home, ensuring the best possible outcome without the burden of traveling long distances for care. Unchecked sleep disorders can cause impaired growth in children, cardiovascular issues such as high blood pressure, metabolic issues such as inflammation or insulin resistance, as well as behavioral issues and an inability to function at school, and just an overall decrease in a child and family's quality of life. In opening Ontario's third pediatric tertiary care sleep lab, we are helping to build capacity for sleep medicine in our own backyard and across the province. Having a good night of sleep is incredibly important. Thank you to everyone who has made this service available to our children and helped to address the shortage of child-focused sleep labs and sleep medicine in our region. Thank you very much.
And thank you. We really appreciate you taking the time this morning, both you and Lynanne, to join us as we celebrate this. All donor dollars make a huge difference to Children's Health Foundation and Children's Hospital, but some are incredibly impactful. And when we see the manifestation of what those dollars turn into, it's a very rewarding and positive time. So very wonderful to be here this morning and to be able to see the lab virtually and to talk about this. I think at this point in time, I'd like to open this up if there are any questions that anyone has. Just want to throw those in the Q&A, and we can try to answer them appropriately. Okay, we have a question. How long has the project been in the works?
I don't know if I'm the best one to speak to this, but I mean, I've been at Children's for almost 2 years now, and to be honest, people had been working on it before my arrival, and that's, I really do need to thank the hospital leadership, Dr. April Price, a respiratory therapist, Kathy Trokey. All of them were instrumental in getting this project kind of building the foundation for it before I even arrived. So I think in reality, this project has probably been in the works for almost 4 or 5 years now.
I would think, I remember I've been here 4 years, and I was aware of it very shortly after my arrival. So it's been quite a while coming to fruition.
And the recognition that we had the need has been around, I would say, even longer than that.
Yeah, we've heard a lot of stories from families who have had to travel, and again, it's disruptive sleeping in not in your own bed to begin with, but to add travel to Toronto or Ottawa or something like that, especially for a child, can be very challenging. How many patients annually was Children's referring to sick kids and CHEO? And the second part of this question, what has been happening with these patients during the pandemic?
Yeah, I don't know the exact numbers. So probably, and again, there's the ones who are coming from myself and my division, but otolaryngology may send some, neurology may send some, general pediatricians and family doctors may also be sending referrals. So, sick kids has had to refuse kind of referrals from older patients. They are still accepting our very young and more complex patients. So it hasn't been that we've had no care for them. There have been patients who we've been able to, again, sometimes you can manage patients without maybe the gold standard diagnostics, and you make do with that based on other tools at your disposal. And then we have been making use of community partners. There's a sleep lab in Etobicoke, Brampton, who for many of our more straightforward older children, they have been able to take on some of that burden. But again, that still involves, quite a bit of travel for families. They can't do the more medically complex children, and it's they do see pediatrics, but they're also kind of more geared as an adult institution. So again, it's just a very different environment. But definitely, I think over the course of the last few years, we do need to send thanks to those partners, because they have been helping to care for the children here, and then hopefully we can take on more of the care here now.
Mm-hmm. I can add a little that we're anticipating about 350 patients a year now that we have that service available, and that's the number that we wouldn't have been able to service. So I think the significant number of referrals would have been quite high that we would have had to lean on our partners in Toronto and Ottawa.
And the other part of that question was, what has been happening with our kids during the pandemic? Have they been able to go to the other sleep clinics, or has that been delayed? Or are either of you aware?
So there was certainly a period of time where I'd say almost all sleep labs across the country were closed. With that said, there is now kind of Sick Kids is running and Etobicoke, Brampton are both running, but certainly their wait times did get lengthened again with the pandemic, and probably they're not seeing the same volume of patients they otherwise would.
So this will help Children's, but it will also help the other programs. We talk a few more questions. We talk about potentially impacting 350 children. The question, and I'm not sure if it can be answered in this context, but how many beds are there in the Children's Sleep Lab?
So again, we are in early days in terms of kind of ramping up and building the expertise to really care for these children properly. With that said, we have installed four sleep beds. Now, we're not going to be able to run them every night. A sleep, this assessment essentially takes all night, and you get lots and lots of data, like many gigabytes of data that then you need to go through and make the best interpretation, diagnosis, and management of a patient. So it's not as simple as, there's a lot of work that goes into a sleep study. First, you need to get the data, then you score the data, and then you interpret the data. So really, there are hours and hours of work that goes into each study. But the straightforward question is, there are 4 beds, and we will be working our way up to kind of filling that capacity and hopefully growing the capacity of the lab over time.
And another question is, and I think Dr. Saint-Laurent, you answered this. How long does an assessment take? The child is in there overnight. Is it a one-time thing? Are they returning on a regular basis? And what are you learning about their sleep problems?
Yeah. So I mean, the sleep test itself, the patient would show up in the evening and would be discharged by the morning, but then the study still needs to be again scored. So a registered polysomnographic technologist would take that data and score it, and then myself or another sleep physician has to look at the scored data and kind of make an interpretation. Depending on what we find, there may be repeat visits to the lab, or again, it will depend on the management, the diagnosis, both the sleep diagnosis and perhaps kind of the underlying diagnosis of the patient. There are certain conditions that maybe require annual or every 2-year kind of polysomnographs. In a patient that has very severe obstructive sleep apnea that you're managing with adenotonsillectomy, so taking out the tonsils and adenoids, you may, depending on how severe it is, you may need to repeat it after that procedure to make sure that we really have resolution, where in a more mild case, it may be that we don't need to repeat the study following. So it again is a bit more of a case-by-case basis. But certainly there will be some patients who are regular patients in the lab, and that includes patients who are on, respiratory technology. So things like invasive ventilation through a tracheostomy or BiPAP through a mask, where at times you go into the sleep lab to actually tailor or titrate the amount of respiratory support someone's going to get. And that's something you will do periodically because children are growing and either gaining or losing strength or kind of just evolving.
Thank you. And we had a question from email. Who qualifies for the services of the sleep lab? How do patients or families access it for their children?
So at this point in time, it will be referral based. And again, we do have a referral form, which has recently been created, and we'll try to make as accessible as possible. And then, the more information you give us, the easier it is to determine where we're headed. It's not every patient necessarily needs a sleep study, especially in the younger patients who have kind of more vague descriptions of restless sleep. Sometimes it's more sleep hygiene things that need to be addressed as opposed to sleep disordered breathing. Patients who are more medically complex, typically I would try to see in my clinic before the sleep study just to make sure that they're safe in the lab and my technologists who are taking care of them are going to be safe in the lab, and we can, there isn't too much unexpected that happens. It's whereas, a patient who's very straightforward, maybe we feel more comfortable kind of moving straight to the lab and skipping the initial clinic visit, especially if we have a really good description of sleep disordered breathing, the kind of thing we're trying to diagnose in the lab.
Great. And Dr. Craig Campbell, Chair Chief of Pediatrics, is asking, can you speak to how the lab will contribute to research at Children's?
So I'm very hopeful that it will be making a significant contribution to research, both at children and provincially, and I guess internationally even. Pediatric sleep medicine, as far as fields go, is still kind of relatively young. So there's still lots we're learning all the time. I'm in the process of creating what I hope will be kind of a prospective database where if parents will consent, kind of just some basic health information will be collected on the various patients, as well as the results of their sleep study. And this we can then kind of try to interrogate and look at in the future to help us understand, sleep disorders in a whole variety of populations, the impact of treatments, and information such as that. As well, the Children's Hospital is a very nice and collaborative environment, and sleep affects conditions, from all kinds of different fields, whether it's neurology, ear, nose, and throat, or otolaryngology, endocrinology, even nephrology. So, certainly I'm eager to work with my colleagues to try to see, where there are gaps and are there ways we can address these things and learn more about sleep medicine and to better care for children with a whole variety of conditions.
That segues very well into the next question. Does pediatric sleep medicine or sleep medicine in general, do you think it flies under the radar? Will this program raise the profile of this important medical specialty?
I think that's a good question. I think it's hard to say. I mean, it's still pretty young, and I think there are times where certainly there are aspects of it which are definitely underappreciated. With that said, you speak to the family who's not getting any sleep, and they certainly appreciate sleep medicine. So I think it's, there's a real recognition nationally, I would say, and internationally, that again, this is a field which is growing and growing rapidly. I think the importance of sleep medicine is becoming increasingly recognized.
Thank you very much. And I think it's wonderful that we have this here. We have it for our children and their families throughout Southwestern and Northwestern Ontario. it is something that perhaps we often don't think about, but it can impact in so many ways. And you referenced some of those points. Again, not possible without donor support. And it's so wonderful when we can clearly demonstrate the tangible impact of turning dollars donated to children's into specific programs and activities that we know make a huge difference on kids, both in the short term and in the long term. So I don't see any more questions, but I would like to thank everyone certainly for joining us this morning. Thank you to my co-presenters and for those involved in crafting the video. And of course, to any of the attendees from the media, if you have further questions, please feel free to reach out, and we can answer those. And with that, I wish everyone a great day and